Thank you very much, Senator Collins. Senator Hickenlooper.
Thank you, Mr. Chair, and thank all of you for your work and your commitment to this at a time when, as both the chair and the ranking member made so clear in their opening statements, this is an emergency, and you all share that sense of urgency. Dr. Swanee, while I was governor of Colorado, we worked hard to expand youth apprenticeship opportunities. I was moved to read the testimony about the different ways Ochsner is using apprenticeships to foster interest in medicine and as a workforce solution. I was especially enthusiastic to learn about the Ochsner Nursing Pre-Apprenticeship program, which is open to high school sophomores hoping to serve more than 600 students over the next 2 years. That really is incredible. Have any of your pre-apprenticeship program graduates remained with Ochsner or stayed in the field, and has opening these programs to high school students helped, do you see an impact in terms of addressing your challenges?
Yeah, thank you very much for that question, Senator. It's early in the program. We started in 2021. We have currently about 350 apprenticeships in the program. By this fall, we'll have 600 students in the program. So it's early in the program. But this grew out of another program, the MA Now program, which is a program where we went into our communities, underserved communities, where they had high unemployment rates, partnered with our local community partners there to identify applicants for our MA Now program. And then we certified those programs. Their 6 months training, we trained them, they got a certificate program to be an MA. Now we have over 600 of those MA we hired through that program. The apprenticeship program for us is very important as we launched our Healthy State Initiative, which is Ochsner's initiative to do a collective impact in Louisiana to improve our health rankings from 50th, which unfortunately is where we've been, 50th to 49th for the last 30 years, to 40th over the next 10 years. High school graduation rate is one of the key factors for our poor health rankings. So this apprenticeship program really gets at two components. One, can we get to our sophomores in high school, keep them in high school by allowing them to work as apprentices to nurses and therefore pay them some during high school. And then they get a free year of community college when they finish high school, and then they're an LPN. So we're early on in the program, Senator, but we're very enthusiastic about it.
Great. Well, I'm very excited about it as well. I've talked to both Senator Cassidy and Senator Sanders about the value of apprenticeships, looking at that on a broader scale in healthcare. The pandemic showed us how important it is to address the shortage of public health workers. And Colorado offers a first of its kind in a state program called Colorado Public Health Works that connects AmeriCorps volunteers with a registered apprenticeship program run by the Trailhead Institute. This allows AmeriCorps members to gain valuable on-the-job apprenticeship experience while helping meet our public health needs at the same time. And Dr. Steger, how can we build out programs like this to help address our larger public health workforce needs?
I'm not sure I have great concrete advice on that. I think these kind of programs are critical. Everyone's talked about the step programs and people going, there didn't used to be a career ladder here for people to get trained and gradually move up from medical assistant to RN to NP, et cetera. So I think the more we can encourage that, the better. I still think this is best done by providers, right? They're the most close to the ground. They can figure this out, so providing them with the resources and incentives to develop these programs.
But facilitating also, I think, using resources like AmeriCorps and making sure that you can facilitate that connection.
That's exactly.
Dr. Hillers, I'll go on to the next one. I can get carried away. Dr. Herbert, I was going to ask you about the IPE and that effort. Well, I'll skip. I'll give that a written question. Just know that I'm very appreciate the IPE model, and I think the collaboration and what it allows providers is a big thing. I will go to Dr. Hildreth, and you've spoken about the critical needs in terms of how important it is to increase diversity. I've been on a number of roundtables where the small numbers of not just doctors but midwives, and in terms of how a expectant mother is taken care of, really women of color don't get offered the same choices.
Correct.
And the only way we're going to change that is really to change the makeup of who are attending to them. How can we foster programs that encourage early exposure, this kind of early exposure at the federal level that makes sure that younger kids see a role for them in healthcare?
Thank you, Senator, for the question. What we've done at Meharry is we've adopted 2 middle schools. And what we do is we make sure that our students in medical school, dental school, and our graduate programs are present with those kids to show them that it is possible for them, because they see students in professional programs that look like them, and we think this is a very powerful way to get students engaged early on and keep them engaged by having our students interact with them. Thank you for the question.
Thank you. I yield back.